Like people, businesses have their journey, their path, sometimes straight, but more often evolving, growing, and adapting to a changing world, creating the need for knowledge in areas like accounting, consulting, tax, technology, areas critical to your continued growth and success. All part of the journey, all part of what we do together with you. Because your success is the destination. MNP, wherever business takes you.
The best way to predict the future is to create it. Peter Drucker said that, and it feels especially true today. Sitting with us are 4 remarkable students who aren't just imagining the future of dentistry. They are actively shaping it. Welcome back to the Pillar Spot. Today, we're exploring how the next generation of dentists sees the profession evolving, especially as new technologies emerge and the core values of the American College of Dentists continue to guide us: professionalism, ethics, excellence, and leadership. And speaking of the future, we are joined by an extraordinary group of dental students, bright thinkers, emerging leaders, and voices we are excited to spotlight today. Joining us today are Ariana, Sophia, Zoe, and Moony. Your perspectives matter, and we cannot wait to hear how each of you envisions the road ahead.
Welcome to the Pillars Pod, everyone. I'm Dr. Sonia Slawuta, joined by my co-host, Dr. Saira Paredes. And today we are thrilled to welcome you and are really looking forward to our conversation as we explore the values that elevate future dental professionals such as yourselves. But first, I wonder if we can take a moment and ask each of you to introduce yourselves and tell us a little bit more about yourselves. Who are you? Where are you studying? What excites you most about dentistry right now? Okay, why don't you take it away? Why don't we start with Moony?
Thanks so much, both of you, for having me and having us. My name is Moony. I'm a dental student at the Schulich School of Medicine and Dentistry. And outside of clinic and all the coursework, I've been lucky to take on a few leadership positions that really shape how I see the profession. Served as class president for the past 2 years. I'm an executive member of the Central Canada for the FCDSA. For my American counterparts, that's essentially our version of ASDA. And most relevant to today, I serve as vice president of the SPIA National Board. But what excites me the most about dentistry right now is that we're entering the profession at such a pivotal time with technology, AI, digital workflows, new models of care. Everything's really changing what dentistry can look like. But at the same time, the core values of the profession, professionalism, ethics, excellence, leadership, they're still what grounds us. So through SPIA especially, I've met students and mentors, people like in this call, the other students, who remind me that our generation doesn't have to wait until we're decades into practice to contribute. So we get to be part of the conversation early, and that's really a special place to be.
Soya, why don't you tell us a little bit about yourself?
Yeah, hi, my name is Soy, and I'm currently a D2 at Schulich Dentistry, Western University as well. And I'm on the same page with Moony as what excites me most about dentistry right now. For me, it's also the growing integration of AI and technology into such a traditionally conservative healthcare field. And it's really exciting to see how the new technologies are being incorporated into our dental education and patient care. And so I'm looking forward to seeing how they continue to shape the future of our profession.
And Sophia, what about you?
Hi, I'm Sophia. I'm going to be graduating from dental school next week. Um, and I also go to Schulich like Moony and Soy. I think I'm most excited about trying to be a clinician out of school. I know we learn like the highest standards of professionalism and ethics in school. I just want to see how that carries out in private practice, and I'm really excited to experience that for the first time.
And last but not least, Ariana, your thought.
Hi, everyone. I'm Ariana. I'm also a dental student at Western University, and I serve as the current Chief Information Officer at SPIA National Board. And kind of to piggyback off of what Moony and Soy said, what excites me most about dentistry right now is honestly how much it's changing. I feel like we're at this really interesting intersection of technology and patient care, and I think our generation really gets to define what that looks like and how it progresses. And it's a lot of pressure, but I think it is really exciting.
Well, that is great, and thank you, all of you, for sharing a little bit more about yourselves. To start us off, I'd like to start by talking about professionalism because it is the foundation of everything that we do. Soy, when you think about stepping into the profession today, what does professionalism mean to you in a world where AI and digital workflows are becoming a part of everyday practice? And Sophia, how do you see your generation shaping the professional identity of tomorrow's dentists? Soy, do you want to start us off?
Yeah, so for me, professionalism means that I'm maintaining transparency with the patients while upholding the boundaries, the ethical boundaries, and like the professional relationship. So as AI and digital workflows become more integrated into healthcare, I think one of the biggest considerations is informed consent and patient privacy. So I feel like patients might not always realize that when AI tools are involved, their information could be processed by third-party systems. And because technology is evolving so quickly, I think we need clearer guidance on how these tools fit into the informed consent process and how we communicate their use to patients. But at the same time, I do see tremendous value in AI's ability to improve efficiency and support clinical decision making. So, my hope is that we use the technology to enhance patient care without losing the human side of dentistry, especially in a setting that can feel intimidating for many patients. I want to maintain the organic conversations and the genuine rapport that can only come from human to human interaction. And so, I think the trust and the empathy and the connection built through these relationships help patients feel more comfortable and understood, and that this will always remain an essential part of professionalism, even in a field with the growth of AI.
Absolutely, I agree. And Sophia, your thoughts?
I absolutely agree with Soy, and I think it's a really cool question to ask. I really believe that our generation is redefining what it means to be professional in dentistry. I think there's been a big shift because for a long time, professionalism kind of meant like clinical excellence, you're composed, there's some authority. And right now, they still absolutely matter. But I think adding something new where we're adding some more relatability and intentional humility into professionalism. I think we're the generation that grew up with information being everywhere. Patients are Googling their symptoms, they're more educated, and they're way more informed and they're more curious and overall more involved in their care than they've ever been before. And like the all knowing authority figure or that kind of dentist doesn't resonate as well with these patients anymore. And instead, I see tomorrow's dentist kind of stepping into more of a collaborative role and guiding patients and listening to them and building real partnerships around their health instead of telling them, oh, like this is what's wrong with you, this is what you need done. So I think for a generation, professionalism and ethics kind of feel very deeply connected to transparency, like what Soy said. And whether it's talking through treatment options, financial considerations, or even like admitting to clinical uncertainty, I think patients and we really value honesty over just perfection now. And patients don't just want like technical competence anymore. They want authenticity and they want to feel heard. So I think our generation is shaping a dentist who's real, like still very clinically competent and excellent, but like also more emotionally intelligent and ethically transparent, and as well as being more socially aware and making sure that patients feel heard. So I think we're kind of transitioning so that we're not replacing traditional professionalism, but we're trying to humanize it.
That's a great answer. I love where this conversation is going because once we start talking about what professionalism means today, it leads us into another pillar growing right alongside us, which is ethics. And Ariana, I'm just curious to know what you think. In this digital era where AI and new technologies are expanding what is possible, what ethical considerations do you think your generation will encounter most often?
I think that's a great question. And I think one of the biggest ethical challenges our generation will face is navigating kind of the line between AI as a tool and AI as a decision maker. Because right now, I feel like we're being trained to think very critically, to look at a radiograph, weigh the clinical picture, and also consider the patient in front of us. And AI can support that process, but I don't think it can replace the reasoning behind it. So I feel like when an algorithm flags something or suggests a diagnosis, the ethical question isn't just, is it right? It's, do I understand why? And am I still the one accountable? So I think our generation has to be very intentional and about not outsourcing our clinical judgment just because a tool is confident. And I think there's the equity piece as well, which I think gets overlooked in these conversations a lot, because we know that technology in healthcare has a history of benefiting some populations way more than others, whether that's because of cost, access, or even the data these tools are trained on. So I think as future dentists, we have an obligation to ask, not just does this technology work, but does it work for everyone that it will be serving? Because if we're not asking that question, we risk building a profession where innovation widens the gap instead of closing it. And the third thing I keep coming back to when I think of this is informed consent and how dramatically that's going to have to evolve as well. Because right now, explaining a treatment plan to a patient is already very nuanced. But when I think of explaining that part of your diagnosis and how it was informed by an AI system, or that your records are being used to train a model, patients have a right to understand that. And honestly, a lot of us are still figuring out how to talk about it ourselves, especially at least for me, like as a second year student. So yeah, I think our generation is going to have to become very fluent in that kind of transparency, and not just clinically, but in how we communicate with the people trusting us with our care.
Absolutely. And Moony, I would also love to hear your perspective. When you think about the ethical side of practicing in this new landscape, what comes to mind?
Yeah, the number one thing, honestly, is just taking it all as it comes. Because for me, there's a right now it's this digital era and it's AI. Before this, it was this new era of social media, and before that, it was the new era of the internet. And so for me, it's realizing that although schools and different professionals and boards can kind of transition based on what's coming, it's less about learning how use these tools and more about applying the foundational concepts of ethics, professionalism, and those true values that are true to our profession to each new thing, to the next AI, to the next digital era, the next social media. For me, especially as somebody who's invested in social media, invested in AI, invested in all the new digital technologies, it's amazing. But then when I look up to upper year mentors like Sophia, who help engage us into the SPIA organization and different other clubs that kind of promote the well-being of our profession, that's where I think the most progression can happen.
Great insights, Ariana and Moony. And I believe that we can all agree ethics is really the compass that keeps us grounded. But alongside doing what's right, there's also the drive to do what's excellent, especially as the tools we use continue to evolve. Moony, how do you see technology helping you deliver excellent care? And where do you think human skill still matters most?
That's an awesome question and I think honestly, the second question is honestly the answer because I think technology is only as strong as the person using it. So for me, human skill is what matters the most in the relationship side of the care, the chair side connection. Technology can absolutely help us deliver more excellent care, can help improve diagnostics, streamline workflows, help with treatment planning, and make care more efficient, the things that Ariana was speaking to. But it can't sit with a nervous patient and earn their trust. It can't hear hesitation in someone's voice and recognize the real reason they haven't seen the dentist in 5 years or may not be taking care of their teeth. Like fear, shame, finances, or previous bad experiences, those are all in the ability to slow down, communicate clearly, build trust, and make a patient feel safe. All that's deeply human. And I haven't even gotten to clinic yet. I'm not even in my clinical years of my dental school journey. And yet I just know that from personal experiences at my own dentist. And I think that's where the excellence really comes in because it's not just about having the best tools or the most advanced technology, although that definitely helps. It's also about knowing how to use those tools while making the patient feel seen, respected, and cared for. So in a way, the more technology we bring into dentistry, I think the more important that the human connection will become because patients still need to know that there's a real person behind all of this who will listen and genuinely care about what they had to eat today or their birthday or whatever it may be.
That human connection is so important. And, I'm very curious, Sophia, to hear your thoughts since you're graduating next week. Congratulations, by the way. Since you have done some clinical components, how do you feel about this? Where do you think human skill still matters the most?
So I feel like at this stage of my journey, human skill is definitely something or clinical skills is something that I'm definitely going to have to work on. I don't think I have the best or that I'm at the peak right now. And it's something that has to grow all the time. I feel like school prepares you for a lot of things, but the real world prepares you for more. So I think it's important to go into this step or this phase in your life going in with humility and excitement to grow. And yeah, I'm just really excited for my learning and to be able to grow as a clinician and integrate all these new technologies with me. And I feel like they will help.
Absolutely. And I'm sure you will do great. And then you're going to share with your peers, what you're learning in your journey as well. Now, excellence is also a very dynamic concept. It's part science, part art, part technology. And that leads us to the fourth ACD pillar, which is leadership. Leadership can feel intimidating when you're just starting out. So I would love to hear your perspective on leadership, how you are thinking about it at this point in your path.
Yeah, so I think when people talk about leadership in healthcare, they usually think about like the research part or the education part or holding some sort of formal leadership position. But like you said, I think leadership can take form in many different ways, like art and also science. And while all those are important, to me, leadership is about being the ambassador for the profession and helping bridge that gap between the healthcare providers and the public. And like, for example, like Moony, who's here with us today, I also use social media to share my journey through dental school, although I'm not as big as him, but I just want to make dentistry more accessible to the general public. And whether that's helping other students explore dentistry as a career path, sharing oral health education, I do think there's value in making our profession more approachable. And I also hope it reduces some of the fear people associate with dentistry, because dental clinic can be so intimidating with loud noises and the unfamiliar environment. And so I feel like by giving them a glimpse of what happens behind the scenes and how we can portray ourselves as human and not just a clinician to them, that they feel a little less daunted by the dentist and a little more familiar. And I think with the increasingly digitized era, I think it's important that we use these platforms and technologies to reach the public and share this reliable information. But at the same time, we do have to be careful about what we're sharing on such a public platform. And to me, that's a form of leadership. So it's not always about leading within the profession, but I think it can also be with engaging with the community and building that trust and helping people get more informed about decisions and a better insight into the behind the scenes of this profession.
That's quite interesting, the connection that you make about using social media platforms and also engaging the community with the work that we do, but also how we are seen by them, right? Like we are more humans in that sense. That's quite interesting. Thank you for bringing that point. Now, Ariana, what does leadership look like to you at this stage in your journey?
I think it's kind of similar to what Soy was saying. It's a lot less like being in charge and a lot more like being intentional. Because, we're still students, we're not running departments or managing teams, but I do think leadership shows up in the small moments. Like, for example, right now at school, it's how you advocate for a patient when something doesn't feel right, or how you show up for your peers when they're struggling through a hard competency or tough week in clinic. And it's just choosing to ask the uncomfortable question in a lecture because someone else in the room was probably thinking it too. I also think leadership for our generation means being willing to sit with uncertainty and still move forward. Because especially right now, dentistry is evolving so fast. There's new materials, there's new technology, shifting patient expectations. And I think a huge part of leading right now is modeling intellectual humility, admitting what you do and don't know, staying curious and not pretending that confidence means having all the answers. And honestly, I think being here today, having these conversations is another form of leadership in itself, because we're not waiting until we graduate to think critically about the profession we're entering. We're doing it now, and I think that matters.
Absolutely, thank you. And joining us now is also Mansha. Mansha, welcome to the panel. Do you want to take a couple of minutes just to introduce yourself? And then I have a question for you.
Sure. Thank you for letting me join in a little bit later. My name's Mansha. I'm graduating in a few days from Schulich School of Medicine and Dentistry. So I'm just newly joining our dentistry circle. I'm very excited to be a part of the community, be a colleague to all of you. I did 4 years of an undergrad. I also did 2 years of my master's, and then I joined dental school, and I've learned a lot through dental school. It's been a It's honestly been a life-changing experience. I'm a different person today than I was when I joined dental school.
Well, we're happy to have you with us, Mansha, and we've been talking a lot about technology and how the profession is evolving. So I'm curious to know, how do you see technology helping you deliver excellent care?
So, as we know, dentistry is always evolving and it's continuously just evolving around us every single day. Today, we have things such as 3D cone beam computed tomography, like CBCTs, which provide more accuracy, efficiency, and patient comfort. A CBCT, for example, can be used to provide detailed views of oral structures for diagnosis and treatment planning. Lately, and especially this year when I was finishing dental school in fourth year, we started using intraoral scanners that have widely replaced like analog impressions, resulting in highly accurate digital models for restorations. And technology such as computer-aided design and manufacturing allows dentists to create indirect restorations in the same day, providing more efficient and safe patient care. And as we know, the upcoming research involves looking into lasers and artificial intelligence, guided implant surgery, and teledentistry, and all of these will enhance the quality and accessibility of dental care. But it's important to keep in mind that although these innovations have completely transformed the field of dentistry, it's important to keep in mind that these tools and technology are supportive and do not replace the expertise of dental professionals. We use our clinical judgment, experience, and patient-centered decision-making to diagnose conditions, develop a treatment plan, and provide care. So the technology that we use can definitely improve precision, efficiency, and even patient comfort. However, the knowledge, skills, and human connection that dentists bring remain essential in providing safe patient care.
Great answer. Now, all of you are bringing, the point of how important it is to have the human connection. And as we know, leadership is evolving, and so is our profession, which brings us to something we are excited to hear from all of you, your vision for the future.
I do agree that leadership is evolving, and so is the entire profession. So let's zoom out for a moment. If you imagine dentistry 10 or 20 years from now, what do you hope it looks like? So let me ask that question to the new grads. Sophia, do you want to start us off?
Yeah, for sure. So, as a graduating D4 who's about to enter practice, the future of dentistry feels less abstract and it feels very personal to me at the moment. I feel like I'm not just imagining it, I'm stepping into it, and it's something that I've given quite a bit of thought to. So, when I think about dentistry 10 or 20 years from now, I don't think I see just better technology. I think there is a very big potential for a better experience for the patient overall and for providers. I think we'll definitely have technology and like AI helping us with digital workflows, AI assisted diagnosis, but like all the technology can also really help us explain to patients the diagnosis. You can have visualization, like cameras, like images, so the patients understand better. And also, I think that there is going to be a lot more minimally invasive techniques in the future because of technology. So I think these advances are inevitable, but what I truly hope evolves in dentistry in 10 to 20 years is how we define success. I hope that dentistry becomes more prevention based or more prevention focused rather than procedure driven, and that we're able to shift from reacting to disease to anticipating it and helping patients receive the care that they need before the problems escalate. So I also hope that patient education becomes a very central part of our responsibility as dentists. And with the technology available to us, I think we have really powerful tools to educate and empower our patients. So I think this is going to change the dynamic between patients and dentists from like a brief episodic encounters to long-term partnerships in oral and systemic health. I also hope that maybe access to care improves in meaningful ways. So I think oral health shouldn't feel separate from your overall systemic health, and oral health shouldn't be a privilege. I think it should be fully integrated into healthcare, and patients deserve to get that treatment. In a leadership level, I think Like I mentioned before, I hope to see more emotionally intelligent leaders, so dentists who prioritize transparency, collaboration, and humility. And leadership won't be just about being the top dentist or like being the head in your office. It'll be about kind of mentoring younger colleagues, advocating for your patients, and trying to influence policy and shaping ethical standards in our profession. So ultimately, I hope that the dentist of the future is kind of known not just for their clinical excellence, but for their ethical clarity and adaptability and maybe empathy. And I will hope that the technology will continue to evolve. Uh, the trust that we have with our patients will always be our most valuable asset. So if we can pair innovation with integrity, I think dentistry can be stronger than ever.
That's a great answer, Sophia. I know I understand your trepidation when I stepped out of dental school 35 years ago. It was the same for me. And in certain ways, I don't think I could have envisioned the changes that the profession has gone through. And in other ways, like the basic ethical professional ways, it has remained the same. But Mansha, can you please feel free to add your vision as well?
Yeah, for sure. I agree with Sophia that dental care should be something that's available to everyone, and we should all try our best to make our care patient-centered. So looking 10 to 20 years into the future, I hope that just like today, dentistry is still continuously evolving through innovation, while being guided by strong leadership and professional accountability and patient-centered care. So advances in technology will assist dentists in diagnosis and treatment planning, and it will, again, transform how care is delivered, making patient care more efficient, precise, and accessible. And as we know that there is already development of new guidelines and regulatory frameworks to ensure that these technologies are integrated ethically, transparently, and with strict patient consent, as in the RCDSO. However, this alone will not shape the future of our profession. Leadership, as you mentioned, is another important pillar, and effective leadership helps guide the profession through change while upholding the high standards of care, advocating for patients, and mentoring future generations of dentists to ensure that innovation is implanted in ways that benefit both practitioners and the public. Strong leadership is essential for the evolution of our career, for sure, as the leadership is critical in balancing progress with ethics, professionalism, and public trust. As Sophia was mentioning, one of my hopes for the future is that high quality oral healthcare is accessible to all populations, regardless of their geographic location, socioeconomic status, age, or background. At its core, dentistry is a service oriented profession that helps patients improve their overall health and well-being and their quality of life. I'd like to see continued efforts to reduce barriers to care and address disparities in oral health. Expanding access to care will require leaders who advocate for underserved communities and influence policies that drive meaningful change within our profession. So, by investing in leadership development, dentistry will remain a trusted and patient focused profession that is prepared to meet the challenges and opportunities for the future.
Thank you for sharing your vision, Mansha and Sophia. And imagining the future brings us to imagining your place in it. So, Moony, when you picture the future of dentistry, where do you see yourself?
Yeah, absolutely. It's funny to say right now, I'm just trying to picture myself surviving second year exams. But when I picture my future in dentistry, I honestly see myself in leadership. And I'll be upfront, I have some really big goals. And I think everyone already knows me at the school as the guy who gets involved in maybe too much. But I think it's like my mom always says, you have to say it, and then you have to will it, and then you have to do the work to get there. And so one day I'd love to be the president of the ODA or a dean of a dental school or help lead a residency program. And even relevant to today, soon after I graduate, like you said, like one of the biggest honors would be being inducted to the ACD as a fellow. And I know these sound like super crazy goals and super ambitious, but it's honestly just, it comes from my background. Like I was born in the Middle East and I love the Middle East. But one of the things I love so much about being in a country like Canada is that we all have true opportunities to get involved, to earn a seat at the decision-making table. to help create real change in the profession and the world that we live in. So when I think about the future, I don't only see myself practicing dentistry, although I love dentistry. I see myself hopefully help shape it, like whether that's through advocacy, organized dentistry, education, mentorship, or even policy. I just want to contribute to the direction the profession takes and make sure students and young dentists have a voice in that future too, whether that means being in our local dental component society or even being on a podcast with a few dental students in the future and being co-hosting it with a few doctors as well. Anything really, as long as I can keep staying involved.
I would love to do that. And, I relate to your vision. I'm Hispanic. I was born in Peru, and I was given a scholarship to go to university when I was living in the States. And I feel like with that opportunity given to me, it also came a commitment to give back to the community. And that's why I became involved with the ACD and other organizations, dental and non-dental related, because I do believe that we have a responsibility to move forward and to help others to be part of that. So believe in your vision, work harder, and you'll achieve all those goals. So thank you for sharing that with us. Ariana, I'm very curious about what you think about this. So what kind of dentist, leader, or advocate do you hope to become as the profession continues to evolve?
I think the kind of dentist I hope to be is someone patients actually feel very seen by. And I don't mean that in like a surface level way. I mean someone who takes time to understand why a patient has been avoiding the dentist for 10 years or why they're nodding along but clearly don't feel comfortable asking questions to better understand what's going on. The clinical excellence matters deeply to me, but I think the best clinicians are the ones who recognize that a patient's mouth doesn't exist separately from their anxiety, finances, their history, and their culture. So as the profession becomes more technology driven and appointment times get more efficient, so I want to be more intentional about protecting that space, the human conversation that happens before you even pick up that instrument. In terms of advocacy, I feel really strongly about access, as I've talked about before. Dental care is still one of the most financially and geographically inaccessible areas of healthcare, and I think that's something our generation really needs to be louder about and change. Whether that looks like community outreach, policy engagement, or just choosing where you practice thoughtfully, I think every dentist has some version of that responsibility. And as a leader, I have to be the kind of person who brings others along rather than just moving ahead, because I think real leadership in this profession isn't just about being the most decorated clinician in the room. It's also about looking around and asking who's being left out of the conversation, whether that's underserved patients who don't have a voice in how care is designed or students who just don't always see themselves represented in places like this one. I want to be someone who actively works to change that, and not just in theory, but in the choices I make every single day as I grow into my career.
Great. And every day could make a huge difference. So what are your thoughts about that? Which kind of dentist, leader, or advocate do you hope to become one day?
I think I'm on a very similar page with Ariana. I think for me, like ACD, it represents the community that reminds us that dentistry is more than just about the clinical skills. So as I grow in my career, I hope to stay involved by helping bridge the gap between our profession and the public. And like I mentioned, we live in a very increasingly digital world. And so it's important that dentists are made to be visible and approachable and trustworthy from their sources of information. For example, one of my videos that I recently made was me going to the dentist and getting a 2/6 DO. And it's been a really long time since I've gotten a filling, I think probably like 10 years. So I forgot what it felt like to be the patient. Like, of course, I've shadowed a bunch of times, like seeing clinicians talk to patients, but it had been so long since I was the patient myself. So it was a very interesting experience where I got to sit in the patient chair and tell them my symptoms and hear the drill against my tooth and the vibrations. So it was a really cool experience to kind of take myself back to what it actually feels like being a patient. And I think from that video, I think a lot of people liked how I explained what each tool and procedure was. So like, for example, when a dentist is putting a Tafelmeyer in, like they wouldn't know what that is. So, and they're just sitting there like getting that done. So I think for me, I want to be a dentist that's able to communicate all the steps clearly so that the patient knows what's happening inside their own mouth and is very comfortable with each step that I'm doing for them.
That's a great point. I mean, it's a very humble experience, but also a very human experience, and it brings empathy to the next level. How was your appointment, though? Everything went well?
Yes, no sensitivity. Occlusion's great.
Awesome. That's great to hear.
Those are excellent insights, and thank you for sharing them. But before we wrap up, there's one more topic we'd love to hear about from each of you, your ACD connection. As future leaders of our profession, how do you see yourselves engaging with the ACD? What role do you hope to play in the ACD community as you grow in your careers? And would any of you like to share your thoughts?
For sure. Well, honestly, to answer that, I think I have to start by recognizing the incredible ACD members I already have had the opportunity to meet. And at every dental school, I think students, especially students here, we know who the go-to people are, like the ones everyone looks up to, the ones who shape the culture of the school, and the ones who model what the profession should really look like. At Schulich, many of the people I admire most, people like Dr. Huckley, Dr. Steele, Dr. Van Rysmick, and many others, are connected to the ACD. And I don't think that's a coincidence necessarily, because before SPIA, I used to think ACD was something really super far away, something you hope to be invited in much later in your career. But through SPIA and through seeing all the amazing things Sophia has been doing through SPIA before I joined, and especially after attending the meeting in Niagara on the Lake, I realized ACD is not just a destination at the end of the career. It's a community that students like us right now can learn from, contribute to, and grow alongside from the very beginning. And so, of course, like I think every single one of us would be honored and be a dream to become a young member inducted to ACD, but it's not something you can ask for. And that's kind of the best part about it. It's something you earn, and it's not in our hands. It's in the hands of the amazing people who lead this profession. But what is in our hands is how we show up, how we represent the profession, and how we support the students around us, and how we carry the ACD values forward. So whether that dream happens exactly the way I imagine it, regardless, I know I want to stay close to this community because to me, and I think to a lot of us, the ACD represents the kind of dentist we hope to become, someone who does not just practice dentistry, but protects it, elevates it, and leaves it better for the next generation.
So, Sophia, Moony called you out. What are your thoughts?
Yeah, I had a similar experience with Moony too, where I had an upperclassman who was involved in SPIA, and I was so impressed by them. I got involved with SPIA, and I met the ACD members, and I really respected the ACD's commitment to ethics and professionalism and integrity. So I wanted to make sure as I'm growing as a student and as a future clinician that I'm growing with the kind of people that I aspire to become. So I want to see myself engaging with the ACD possibly as a leader first or as a learner first, and then maybe move on to someone in a more leadership position. I really feel like it's important to get younger dentists involved in the ACD, even though it is such a prestigious, I think, honor to become a member of the ACD. I think it's important to bridge the generation between the younger dentists and the older dentists, because I think dentistry is something that has to be continuous. You shouldn't just jump to an ethical professionalism, a great standard of ethics and professionalism when you're older. I think it's something that you have to continuously work on. So I think it's really important for younger dentists to get involved. So hopefully I can help bridge that gap between the older and the younger generation. And then long term, like what I did with Moony and hopefully like Soy and Ariana, and they were interested to get involved. I think it'd be really fun to mentor younger dentists and students and help normalize the conversations about ethics dilemmas in the profession, and like talking about burnout, professionalism. I think like leadership in the profession means protecting its values, and I really want to play a role in preserving and strengthening that culture. So maybe I can be a part of the ACD in the future, but we shall see.
Absolutely, and you would be a valuable member of the ACD. Soy, what are your thoughts? You're a leader in SPIA. What do you think?
Yeah, so I also got involved because Sophia invited me out to one of the annual conferences, and then I didn't know of like such thing existed. I didn't know what SPIA was. I didn't know we had a chapter at school, and I really wished I did because I think I would have gotten involved earlier on. But I'm still glad that I still chose to show up to the conference and then become the regent of Canada. And I think it's just brought me so many new experiences and allowed me to meet so many new people with different backgrounds and different perspectives on different issues. And I think it allowed me to have deeper conversations with these people and have different insights. Whereas if I just stayed within my community or just thought about it myself, the thoughts, and like it just wouldn't have been as deep. So I really appreciate the opportunities that it has given me to make such connections with people that have similar interests and thoughts and goals in mind within the profession as me.
Yeah, connecting with colleagues, both young and old, who have similar goals and similar thoughts of the profession is really important for all your dental life, really, and all your professional life. Ariana, how do you feel about this?
For me, the ACD represents exactly the kind of community that I want to grow into. And I think what makes that connection even more meaningful is SPIA. Because as a student, it's been the bridge. Honestly, it's where professionalism and ethics stop being like abstract details that you read about or see in social media posts and start becoming things you actually wrestle with alongside your peers, and a space that's open and non-punitive and genuinely committed to growth. And this year, obviously thanks to Sophia, who introduced us to the wonderful world of SPIA, stepping into a leadership role within SPIA as Chief Information Officer really has changed how I think about what it means to serve a community. And it's one thing to believe in an organization's mission, but it's another to be responsible for how that mission gets communicated and carried forward to other dental students and other professionals. And it really pushed me to think more intentionally about how we reach students and how we make these conversations about ethics and professionalism feel accessible rather than intimidating. Because I really do think the earlier students engage with these ideas, the better dentists they become. So long term, I'd love to be someone who also mentors the next generation of students, the way that this organization has invested in us, showing up for them the way that people showed up for me, because that cycle of giving back is what keeps a profession healthy and keeps it human as well. And being part of community that's having conversations like this one about the future, about values, and about who we want to be in the future, it's exactly where I want to plant myself as I want to grow.
Great answer, Ariana. And Mansha, as a new grad, what are your thoughts on this?
I agree with everybody here. ACD is a very prestigious community. And as Sophia mentioned, it's important to surround yourself with people that you want to be similar to, or it's important to surround yourself with people who help you become who you want to be. So that's part of the reason why I want to stay connected with the ACD, because I put a lot of value on integrity, ethics, and professionalism. And as we've been talking about it, it's important to learn this while you're growing. So I wanted to be part of SPIA when I started dental school. I've been part of SPIA since first year. And that's because I believe that if it's something that I start with my dental school journey, it is something that'll become a part of me and a part of my personality as I'm working through dental school. And I have noticed that in the past few years, how everything that I've learned through SPIA and ACD actually came to light while I was providing patient care. It's nice to see that something that I invested in first year actually is helping me become the clinician that I want to be, is helping me provide care to patients the way I want it to. And it's always a great opportunity to learn from everyone. I like that we have annual meetings and events where we can get together and discuss, for example, just like this podcast, where we can sit down and talk about these things, talk about our future. As Ariana was mentioning, it's important that we talk about it now so that we can plan for the future. We can't really do things in the future if we don't plan for them. The fact that we're sitting down together, figuring it out, means that we're all invested in making our profession better. And a way to do that is through being a part of the ACD. And that's why I'd like to stay connected with the ACD. For fun, though, I enjoyed being part of the ACD because I was given the opportunity to make like all the invitations and all the posters and everything. So that was kind of like a fun thing that I did for the ACD. And I really enjoyed it because to me, it's kind of like a hobby, but everybody wins. So learning from everyone who's part of the ACD, learning from both of you at the beginning, and then hopefully earning my place into the ACD in the future is what I hope for.
I love the fact that all of you have a very strong ACD connection. That's pretty inspiring. And Sophia and Mansha, please stay connected. I know you guys are going to be graduating in a few days. Congratulations again. But as Ariana, Moony, and Zoe have mentioned, part of being an ACD fellow is also like have that mentorship component where like you are going to be shaping the next generation of dentists, and we would love to be involved with all of you because there is so much more work to do and so many more opportunities to take part of. So please stay connected. I'm sure we could come up with something where like all of us could still work together and keep helping and keep building the future. And as we close today's conversation, I want to take a moment to reflect on what we have heard, because your perspectives, your hopes, your vision remind us why the future of dentistry truly starts with the five of you. So the five of you have shown us that professionalism isn't just a standard, it is a mindset. That ethics isn't a rule book, it is a responsibility. That excellence isn't perfection, it is a commitment to growth. And that leadership isn't just a title, it's a choice you make every day. Big steps, small steps. So whether you're months from graduation or just beginning your path, you're entering a profession that needs your curiosity, your compassion, and your leadership. So thank you for joining us, and thanks to our incredible student panel for giving us such a clear look at the future they are helping to shape. Thank you so much.